My name is Sean Collins. I'm a radiation oncologist at Georgetown University Hospital. I also work with Lombardi Cancer Center. So I've been using the SpaceOAR since November 2015. I came to the Astro meeting where Dr. Timmerman was giving a talk, and he just blew me away with the outcomes he was getting with SpaceOAR. We were interested in SpaceOAR because we had some patients that had high rates of rectal toxicity, and we thought that the SpaceOAR would be good to utilize to reduce rectal toxicity. So he showed a lower rate of late rectal bleeding. Also, he showed that even when you were doing dose escalation, there was reduced toxicity. Well, most of the time, patients are really concerned about urinary, bowel, and sexual symptoms. They're worried about urinary incontinence, they're worried about late rectal bleeding, and they're usually worried about losing their erections. Well, the great thing about SpaceOAR is that your prostate's actually really close to your rectum. It's like right next to each other. So if you put a 1 centimeter gap between your prostate and your rectum, it really reduces the amount of radiation that the anterior rectal wall gets, and that can really limit the late rectal toxicity. The best thing about the SpaceOAR program for me was the team at Augmentics and now Boston Scientific were with me the whole way. They supervised my first 10 cases, and I really felt that I was doing it safely, giving my patients a benefit without putting the early patients at risk. And I think the late rectal toxicity is a lot less when you use a SpaceOAR gel. And managing rectal toxicity can be a significant trauma for both patients and their doctors, and I think there's truly a benefit in that. We've treated 1,500 patients over the last 12 years, and we follow all of them. When I was a resident, I didn't realize patients were having late toxicities because I never saw them because they were following up with the urologists. Now that I follow my patients, I realize that late rectal bleeding can be a real problem, specifically for elderly men who are on blood thinners. So I think you must be aware that your patients do have side effects, follow them, and this can improve their outcomes.